Hello, I'm Gillian Samuel, the Public Involvement Coordinator and Peer Researcher. This presentation will be looking at public involvement throughout the programme. It will include insights into our strategy, how our team work together, and reflections on our practice. It will highlight some of the key learnings, impacts and changes which took place over time. Next slide. Step 1. The partnership between us and UCL built on previous work that we have done with the programme leads, namely Kate and David. This was an advantage as there was already a shared understanding on how to deliver public involvement work in research. Step 2. The first challenge was to build a team of peer researchers with diverse life experiences and an interest in public mental health research. We gathered a team of 7 people. This, together with their connections in wider communities, meant that we could develop a public network essential for the programme, as well as doing detailed work drawing on different aspects of peer researcher identity, such as genders, race, geography, and class. Step 3. We embedded our involvement practice into the structures and research projects across the programme. We believe that in doing so, this would bring lived experience and the voice of the public into the heart of research. Next slide. Our team instinctively knew it would be a huge challenge to understand and to work both within and across the vastness of the public mental health programme. It was essential that we supported each other, and to do this, we spent time getting to know each other. This was done with care and sensitivity, allowing each other to disclose as much or as little about our lived experiences as we felt we wanted to. We developed some work principles based on respect and held peerness days to strengthen our bond. This camaraderie proved essential as we met with the challenges of the work. We would look to each other for guidance and support. Next slide. Our peer research involvement in phase 1 rapidly developed. For example, before long, we had a presence in programme-wide meetings and in all the work packages. This gave us the opportunity to contribute to help shape the research. We co-led public consultations and workshops and co-created programme outputs such as blogs, posters and papers. Our team built the website I Am Public Mental Health, through which the public benefited by having their voices heard. This was especially impactful during the pandemic via the COVID Life project. By co-creating the conceptual framework, public health practitioners now have the chance to benefit by accessing this via the SPHR website. This in turn will support policy prioritisation and development. Here's Ollie with some reflections.
Hi, my name's Ollie and I really enjoyed my time working on the public mental health programme. I took part in many of the larger meetings, part of the programme, contributing my own views and representing the public in those discussions. I really enjoyed the I Am Public Mental Health project, where I helped out with the blog in getting the views of the public out there and the artwork of our team distributed, and I'm really excited to see how the project evolves over time.
At the end of phase 1, our team wrote a report from which key learnings were identified and shared. This led to changes in phase 2. For example, peer researchers became involved right from the onset of work packages, enabling us to co-produce all aspects of research. Our team was challenged by a change in membership and by the pandemic. Not being able to meet face-to-face was a limitation, but we were able to successfully lead a work package, resulting in a shift of our role to peer leadership, allowing us to operate with greater autonomy. We co-created the buddy system to bring together in pairs peer researchers and university-based academics Together, they shared information and knowledge which has resulted in closing the gap. Next slide. Our peer research team led a qualitative study using photo voice. This has involved a team of lived experiences researchers doing in-depth interviews with 30 residents in Lambeth or Harrow. Here is Sandra talking about our work and how we used our peer experiences.
Also, sharing a bit of our own lived experience have prompted the participants to explore more of their own story, particularly when the topic might be too personal or the participant might be reluctant to bring it out. As a peer researcher, hearing some of the inequalities and the impact it had on the participants' own mental well-being triggered my own emotions too. At times, it made me feel uncomfortable, but what got me through was having another peer researcher during the interview and knowing that there is support in place for me if I need it immediately after conducting the interview.
The co-production approach is indeed bearing fruit. It has ensured a high impact across all the areas of the programme on quality, relevance and inclusivity of work. This is reflected in how PPI has become a central focus. We have broadened participation of the public, who are now in conversations on how to shape the body of research moving into SPHR3. On reflection, we have progressed from the humble beginnings of a small team to embedding and extending public involvement. Next slide. Here are the different ways that you can keep in touch. Thank you.